Hello everyone, myself Parmar Maulik. Today, fourth year B physiotherapy student at Marwadi University. Today, we are going to learn about the lumbar spine assessment. We all know about the lumbar spine as a huge topic, which is a vast topic in the medical field. It's very much difficult to diagnose a lumbar spine. So, in which we learn something like the non-mutations. In the demo, first starting with the demographic data, in which we are having the name. We are taking the name for the documentation purpose as well as to familiar with the patient. Now the age. We must know about the age of the patient. Certain age, like in the 15 to 40 years of the age, there are more chances to more prone to get a disc injury. In the more than 45 years, it's the most likely, the most prone to the osteoarthritis as well as the ankylosing spondylosis, as well as the ankylosing spondylitis is mainly found in the 18 to 40 years. Then we are going for this gender. In the gender, female are more prone to get a lower back pain. In female, we also ask about their menstrual history, their menopause history, their occupational history, as well as their any kind of the past medical history of the osteoporosis. In the male, the more chances to get ankylosing spondylitis. Now we are going into the address. If we have to ask about the patient, if the patient is living in the tenement as well as the flat. If the patient is living in the flat, there is the facilities of the lift is available or not. In which we are going to the occupation. Occupation is the most important in the lumbar spine assessment. We need to ask about the patient occupation, in which we have to ask about if the patient is doing the light work, heavy job like the driving a truck, as well as the strenuous activity that can cause a more weight, more load on the disc as well as the lumbar spine. Now we are going into the history component. We are only seeing the positive findings which found in the lumbar spine assessment. Now we are going into the history. The present history. In present history, we needed to ask about the patient, how mechanism of injury. If any kind of the trauma, if any kind of the road traffic accident, it occur in the patient or not. Then we have to ask about the duration. It's an acute, subacute or chronic condition. If the patient is complaining about the acute, subacute or the chronic, most chronic low back pain, it's the yellow flag. It's the acute pain, it's the persistent increases the pain, it's the red flag to the physiotherapy. Now we are going into the past history. We need to ask about any kind of the past history of any kind of the trauma, osteoporosis as well as the another back injury. Now we are going to do the surgical history. We need to ask about the patient. In the female, mostly the female is having the history of hysterectomy, as well as in the male, we have to ask about the prostate, any kind of the history of the prostate enlargement. Drug history. If the patient is continuously taking a steroid, it may cause the osteoporosis in the long term. Then we are going into the medical history. In medical history, we need to ask about the diabetes, thyroid, as well as the hypertension to plan a proper protocol to the patient. Now we are going into the occupational history. We already know. In environment history, how the patient living in the which environment, it's very much important. If the patient is living in the slum area as well as the urban area or rural area, it cannot be possible to everyone come to our OPD by regular basis. So in urban history, we need to ask for personal history, the sleeping pattern as well as the sleeping type as well as the sleeping duration. If the patient's sleep cycle is altered or not, if the patient is having any kind of the addiction, like the drug addiction, like the alcohol, as well as the toilet. First, we need to ask about the side of the pain. In this side, we have a back dominant as well as the leg dominant. In back dominant, patient symptoms are two. If the patient complaining of the pain while flexion, then we need to check a disc involvement. Then extension, we need check a facet joint. In the leg dominant, if the patient complaining of the pain below the knee while the flexion, then it can be a nerve irritation, and as well as if the patient is complaining of pain while walking, it's known as the neurological claudication. Then we need to ask about the radiation. If the patient is having the radiating pain or not. If the radiating pain occur in the whole leg as well as the flexion, that is suggestive of the L5 disc lesion. Then we need to ask about the if the patient is radiating pain over the groin area or the anterior thigh, then it may be the cause of hip pathology. Then we need to ask about the lumbar spine as well as the SI joint, when the patient is complaining of the pain in the buttocks area or the posterior area. Okay. Then we are going into the decoagulation. If the patient is complaining about the morning stiffness, then we need to check about the osteoarthritis as well as the ankylosing spondylosis. Then severity. Severity we can measure in the according to NPRs at the rest as well as the activity. Aggravating factor. If the patient is complaining about the flexion is increase their symptoms, it can be suggestive of space occupying lesion, as well as the patient is complaining about the pain in the extension. It's known as its may cause the extension. If the patient complains about the pain after some kind of the rest, it means the patient is having ankylosing spondylitis. In observation, we have to see about the body type. If the patient is having mesomorphic, ectomorphic or endomorphic. In the gait, if the patient affected gait is mainly due to the pain or relieving symptoms, like if the patient is having this neck pain, if the patient is relieving by the right side, then patient will do the right side. Then we have to check about the attitude of the patient. If the patient is having the bored, lethargic, tense or not, then we have to check about the posture. In posture, we have to check the indulgent posture as well as the loss of the lumbar lordosis as well as the lateral shift or the scoliosis. If in the posture, we have to check about the pelvis in the neutral position or not. If the patient's pelvis is not in the neutral position, then we have to suspect about the lower cross syndrome. Then we have to check about the markings. If the top of the head is present in the back of the area, then it's mainly the spina bifida. Then skin marking, it's mainly due to the mesodermal dermatitis. Then we have to check about the deformity. Any kind of the step deformity present or not. Step deformity is the kindly like the spondylolisthesis. We have to check about the step deformity. Then we are going to the palpation. For palpation, patient must be having the spasm of the paraspinal muscles as well as the tenderness over the paraspinal muscle as well as the site of the lesion. Then trigger bone, scar, edema. If it is present, then we need to check about the bone palpation. We have to check about the pain area. If the patient complaining of the pain in the abdominal area as well as the lateral area of the abdominal, then we have to suspect the abnormality in the vitals. Now, on examination, we have to check about the active range of motion of the lumbar spine, hip joint, knee joint as well as the ankle joint. In the we have one test like the squat test. We need to ask about the patient to do a 90-degree flexion and then squat down. If the patient is the limited range in the hip joint, knee joint or ankle joint, then patient cannot able to do a squatting. If the patient is not able to hold the full flexion of the arm, then it's maybe the pathology in the lumbar spine range of motion. Then we need to check the passive range of motion. It's too much difficult to check a lumbar spine passive range of motion. Then we need to check, we directly go the special test. An MMT of the whole muscles, paraspinal muscle, abdominal muscle, leg extensor, we need to check. Then we are going into the resistant isometric. Resistant isometric, we need to check about it to identify the involvement of the nerve, muscle as well as the joint. Then we need to check about the limb length discrepancy. If the patient is having a true leg limb length discrepancy or the apparent. if the patient is having the short leg as well as the long short leg on the affected side, it may cause the back pain. Then we need to check about the special tests like the slump test, SLR test or coronary weighting for the neurological symptoms. Then HI test for the lumbar instability, passive lumbar extension test, bilateral SLR, quadrant test. We need to check about the joint dysfunction. Then we for the muscle tightness, 90-degree SLR, for hamstring, over, rectus femoris test, Thomas test for the muscle tightness. In the case of the lumbar spine, we also checking about we are doing the differential diagnosis. Differential diagnosis, I have already told since last the demographic data till the special test. Now, then we physiotherapists need to do need to include the ICF. Now we are going to now I am explaining about the management of the lumbar radiculopathy. First goal of the our first goal to relieve the pain. In the pain relief, we can go for the our electrotherapy modality like the TENS, IFT, ultrasound, as well as the IFT, TENS, ultrasound to the pain relief purpose. Parameters according to the patient pain, patient condition, patient severity, we can modify the parameters. As well as we can go for the patient, we have to tell the patient to do a IC. Then posture correction exercise. In the patient of lumbar radiculopathy, we need to check the scoliotic posture. In the case, we have to give a patient to the scoliotic correction exercise, as well as the pelvic tilt. It's not in the neutral. Then we need to teach the how to pelvic tilt in the supine type, cat and camel exercise, and then the cat and camel exercise in the standing also we need to ask about the anterior and posterior pelvic tilt. And the standing, the patient of the lumbar radiculopathy, in which the patient is having the low weakness on the affected side, or in weakness of the hamstring, gluteus, as well as the whole lower leg, as well as the abdominal muscle. Then we need to strengthen a muscle of the abdominals as well as the back extensors, in which we are going for the we need to ask about the patient about the crunches like the back pronon forearm, pronon elbow. Then we need to we are going into the like the pilates to strengthen the core muscle. Then we do the knee extension with the resistance, knee bending, hamstring curls, like the strengthening purpose. Then we go for the endurance training. In endurance training, we need patient is having the low endurance in their comfort or the environment. They cannot able to stand prolonged period of time. They can not to walk prolonged period of time. Then we need to improve their endurance by the cycling, by the treadmill, by the treadmill or cycling. Then activity modification. The patient activities, those patient is daily basis of the activity that patient doing it by themselves. Then we need to modify their activity. Like the patient is having the occupation like the stairless activity, then we need to check. We need to ask the patient to do a less amount of time, as well as we need to give ergonomics advice.